Didn't I tell you that I was a savage?
Hey guys, welcome back to my channel, to Being Bougie by Miranda. So as you can see by the title, today I am going to go over the steps on how I became a licensed health insurance in my state. So I wanted to come on here looking very professional today, because being in the health insurance field, you have to be a professional. You are going to be an expert in this field, so you have to make sure you are looking the part. I'm just going to give you guys a little bit of insight on what steps I took personally to get my license, just to give you an idea as if you didn't know where to start or where to start as a framework. But every state is different, so you want to make sure that you are researching your state requirements. But I also want to make sure that you also know that this is an investment. So you will be having to pay for things when it comes to your license, whether it's going to be the state exam, whether it's going to be a pre-licensing course, whether it's going to be background, fingerprinting. Those are going to be upfront costs that you are going to have to cover, but it will be rewarding once you pass your state exam and you get your license. Now, the first thing I did was complete a pre-licensing course. This is what was required by my job. In order for me to work for them, I had to go through a pre-licensing course. Now, this might not be required by your state. Basically, what the pre-licensing course does, it really prepares you for the state test. It really helps dive into the text material that you are needing or are required to read before you take your state exam, and to really review all of the state and federally regulated requirements in the healthcare industry. The course that I was required to take, it was a 40-hour course, meaning that it was for 5 days, which were 8-hour days. And in those 8-hour days, my instructor took that time to go through our course material, review, answer any questions, do pre-test, play study game, just so that we were able to memorize the material. At the end of that 5-day course, I had to take a course exam and pass with at least a 70% or better in order to take my state test. Now, if you decide to take a pre-licensing course and it's not required by your company or it's required by the state, again, you don't have to worry about it. But as a recommendation, I feel like me doing the pre-licensing course helped a lot with me passing my state exam. And again, I didn't have to pay for that cost. The company that I work for, they fronted that cost on my behalf. Once I passed my pre-licensing course, I then had to go to a local UPS to submit my fingerprinting. And basically, you do have to submit a background when you are in the insurance industry or the healthcare industry. These insurance companies are going to do a thorough background check on you to make sure that you don't have any open or pending cases. So you do want to make sure that note that you are going to go through some type of background. And again, you're going to want to look up your state requirements on what type of background procedures you're going to have to meet. The next thing I did on my journey to be getting my health insurance license was actually taking the state exam test. Now, before I did take the state exam test, I did a lot of studying, guys. It's not a test you're gonna wanna play with. It's not an easy test to pass. So I basically studied from sun up to sundown for 3 days straight before I took my actual state exam test. And once I was in the test, I did have a strategy plan. I made sure that I answered all the questions that I knew first, and any questions that I didn't know, I would bucket them and revisit them once I passed through the entire section. On the state exam for Florida, there's 3 sections, and it seems so long ago, but I believe there were 3 sections on the test. Each section had a certain amount of numbers of questions on the test. So what I did was I would answer all the ones that I knew, that I absolutely knew, bucket any ones that I didn't know, and if I did have time left over, because this was a time test, it's going to be a time test. I'm not sure for your state, but in the state of Florida, it is a time test. If I had time left over, I would go back to the questions that I bucket and see if I can really take time to answer those questions at that time. Because with my state exam, it sets off after your time has run out. For the state exam, especially for my state, I had to make sure that I passed with a 70% or better. Now your girl passed with an 80%, but it's not easy. It wasn't easy at all. Like I said, I did my due diligence and I studied the material a lot. I literally dedicated sun up to sundown for 3 days straight studying for my test. So that's how I was able to pass with the 80%. Not everyone passes on the first time because this test is not designed for everyone to pass. Again, you are dealing with a federally and state regulated industry. They want to make sure that people know the information when going to selling health insurance. Now, in the state of Florida, you have up until 5 attempts to pass the test in a 12-month period. So if you don't pass the test on the first time, it's okay. It's not the end of the world. Not a lot of people pass on the first times. So you want to make sure that, again, you're researching what those attempts, how many attempts you can take in your state. After I passed my exam, basically I was issued my license right away. It's not like I had to wait where they mail it to you or anything like that. They literally printed it off, passed me my paper, and it had my information, my Florida producer number on there. In order for me to keep my license up to date, I have to do a continuing education every 2 years. And again, this is in my state. And basically with the continuing education, I just have to take a course. I believe it's like a 4-hour course, making sure that it does include ethics, and it really just refreshes any new regulations on the healthcare industry that I would need to know as a healthcare agent, so I am providing that information to my clients. So you do have to make sure that, again, you're researching what that continuing education is for you to make sure that you are keeping your license intact. I hope this video was very insightful. Again, these were the steps that I took to get my health insurance license. You want to make sure you're doing your research and you're knowing what your state requirements are. It may be more than what I have to do. You may have to do additional steps, or you may have to do less steps than I do, but you do want to know that it is going to get done. Be thorough. Again, it sounds easy, but again, it is going to be a process. It's a process to get your license, so be patient with the process. And again, if I can do it, you can do it too. So if I didn't answer any questions in this video and you do have some more questions for me, or what videos you think I should touch on when it comes to the health insurance field, make sure you comment below, and also don't forget to subscribe. Thank you again for watching, guys, and good luck on your license.